The following skills will be based on a client placed on droplet precautions. First, the client requires assistance with a partial bed bath, which includes male peri care. Second, they require assistance to their wheelchair. Third, they need assistance with cleaning their dentures and performing oral hygiene. Let's look at the first scenario. As a student nurse, you have been assigned to care for this client who needs assistance with a partial bath. What are your first steps? Let's look at our video of this scenario to help guide us.
So in this video, we talk about how to properly introduce yourself to a client, as well as what you do before entering the client's room, and then performing a partial bed bath. So upon entering the client's room, you want to check the patient's chart. We do this in order to make sure that we have the right patient, we know what tasks we will be doing based on our knowledge, and as well as learning any extra information about the patient. So any religious values that they may have, any allergies or preferences, etc. So we know we're going to be performing a partial bed bath, and we also know that the patient is on droplet precautions. Therefore, we need to have our proper PPE.
The video points to the importance of checking the client's care plan. Checking the care plan ultimately allows the student nurse the knowledge to providing safe care. The care plan provides the student nurse information of the client's limitations and abilities, as well as specific instructions to follow. One important aspect of the risk assessment is knowing the client's isolation status, and the PPE to wear, which one would find in the care plan. Looking at the client's care plan allows the student nurse to start making their assessment. So knowing from the client's care plan that the client is on droplet precautions, let's look at another video to help us better understand the donning of PPE for droplet precautions. Droplet transmission refers to large droplets that are spread from individuals when they cough or sneeze. When the droplets are released, they can't suspend in the air, they only go a short distance of less than 2 meters. They enter a host through their nose, mouth and/or eyes. Wearing a mask and goggles, performing hand hygiene, donning and doffing PPE correctly prevents this. Let's connect this back to our client scenario.
So I'm going to wash my hands for the appropriate time it takes before entering the room. 20 seconds or longer. Make sure my hands are dry if I'm using soap and water, or if I'm using sanitizer, keep going until dry. Correct donning of droplet PPE is mask, goggles. This way, we help prevent the transmission of any droplet infection that the patient may have. Upon entering the room, we want to knock the door and call to the patient and see if they feel comfortable with us entering the room. The patient says yes, so we walk in with our supplies. Hello, Mr. Smith. My name is Trina Grant, and I'll be your nurse for this evening. Today we're going to help you do a partial bed bath. Are you comfortable with that? Okay, I have now prepped the patient and raised the bed to a safe working height. Underneath the patient's head, you may want to apply a towel so no water will drain on the pillow, as well as make sure your patient is comfortable while performing the procedure. So I'm going to provide privacy by covering the patient. And I have an extra towel here to place in an area to dry. And I have a basin with warm water. I'm going to ask the patient if they can tolerate it. And as I go through the procedure, I'm going to encourage them and ask them if they feel comfortable with performing any help through the procedure, or if they just want me to do the entire skill. So this way we have the rag folded in 4 to make it easier, or a mitt. Soak the rag, squeeze it out, clearly dry. With just water, we're going to clean the inner eye outwards, change, inner eye outwards, change, wipe the face and the neck, discard, and dry. At this point, if the patient has any ointments or wants any lotion put on their face, we can do it then. Moving on, I'm going to expose more of the patient and place a towel underneath their arm. As we do this, we're going to clean the patient's hands upwards to make sure that we're promoting blood circulation going to the heart. Next side, same thing. Now, I'm going to dry. I'm going to then clean the patient's underarm. Fold, other side, discard, dry, dry. Now, any personal hygienic products or unscented deodorants can be applied if the patient would like to do so.
Although not fully shown in the video clip, the client's underarms and their hands were washed with soap and water, rinsed and dried with a clean part of the cloth with each wipe. Let's continue with that partial bed bath.
Now, before I provide pericare to my male client, I'm going to first start by checking their care plan that I brought in with me earlier today. I'm going to check for specific details pertaining to my client's abilities and limitations, and also any specific instructions that I should follow. So now that I've done that, I'm going to perform hand hygiene to ensure I'm not spreading microorganisms and putting infection control at risk. I am now going to explain the process to my client and gain consent to provide care. I'm going to determine how much my client is able to do himself, or that he might be willing to do himself, encouraging him to help to partake in the pericare process and promote client independence. After speaking with the client, he has asked me to provide the peri-care. So with that consent, I will prepare my supplies that I've already gathered, that I've already brought into the room earlier today. Even though I am not leaving the room, I will be leaving the side of the bed, so I'll put the bed in the lowest position with the side rails up to ensure my client's safety. The supplies that I have gathered and brought over to the side of the bed on a side table include a basin with warm water, bath blankets, bath towels, washcloths, soap, extra gloves, extra hand sanitizer, and off to the side I'll put a laundry hamper and a garbage pail. Before I start, I want to get the client to check the water that I brought over, to check that the temperature is to their liking. I have also checked the water temperature just to ensure it's not too hot or too cold to ensure my client's safety. Now that my client has okayed the water temperature, I will double check that the privacy curtain is still pulled to ensure client privacy. And I will also increase the height of the bed to my waist level, putting the side rail down so that I'm able to use good body mechanics while providing care. Now to start the front peri-care process, I will perform hand hygiene and don my gloves. I will now, with my client's consent, turn them onto their lateral side and put a blue pad underneath their buttocks to ensure that the bed doesn't get wet or any secretions don't get on the bed. I will now, with my client's consent, fold back the blanket and place a bath towels over them to provide warmth and privacy while I provide peri-care. I will start by washing the client's thighs. I will take a cloth, fold it into four, wet the cloth and add soap. Then I will wash the thighs using a clean part of the cloth with every wipe. After washing, I will rinse using the same technique, and I will pat dry the thighs. Now, I will help assist the client into assuming a dorsal recumbent position, which is not contraindicated in their care plan, and it will allow me to provide better care because I will have better access to the genital area. Now, I will expose the client's perineum and gently raise the penis and place a bath towel underneath it. At this point, if the client has an erection, defer the perineal care process. I'm now going to take a washcloth, fold it into four, wet the washcloth, and apply soap directly to the cloth. If the male is uncircumcised, with my non-dominant hand, I would gently pull back the foreskin to wash the head of the penis. Because my client is circumcised, I will just be directly washing. I will wash using a specific technique, washing from the tip of the penis at the urethral meatus first, using a circular motion, cleansing from the meatus outward. This ensures I am following best practice guidelines in washing from clean to dirty to ensure bacteria is properly removed and so that bacteria cannot enter the urethra and cause an infection. I will also use a clean part of the washcloth with each wipe to ensure that bacteria is not spread on the skin and is removed so it can't be again introduced into the urethra and cause an infection. Such situations could put the client's health at risk. Now I will rinse using the same technique with a cloth with just water on it. I will now dry the head of the penis to ensure bacteria and skin breakdown will not occur. At this point, if the client is uncircumcised, I will return the foreskin to its natural position. In this case, my client is circumcised, so I don't have to worry about that. I will now wash the shaft of the penis with with gentle but firm downward strokes, again following the technique of cleaning from clean to dirty. Applying soap to a wet washcloth, and again using a clean part of the washcloth with every wipe. I will now rinse using the same technique with a cloth with just water on it. I will now dry the shaft of the penis to ensure no skin breakdown or bacteria growth will occur. When washing and drying, I paid special attention to the underlying surface of the penis, as this is a warm, moist place for bacteria to grow, so it must not be missed. Now I will wash the scrotum from the farthest to the nearest, using a clean part of the washcloth with each wipe, and applying a bit of soap to the washcloth. Using the same technique, I will now rinse the scrotum with a washcloth with just water. I will now pat dry. As I was washing, rinsing, and drying, I was paying close attention to assess the skin for any type of redness, dryness, swelling that would indicate signs of skin breakdown. And also I was looking to see if there was any discharge or unpleasant odors to mark the signs of a urinary tract infection. It's so important to check for this when you're washing, as this can put the client's health at risk. I will also at this point ask my client if they have any symptoms of a urinary tract infection, like burning or discomfort upon urinating. So I'll go do that now. And now I will doff my gloves and perform hand hygiene, as this is the end of the front pericare process.
While we're going to clean the back, we assess if the patient is comfortable, ask them how they feel. We're going to get a separate rag, clean soapy water, and clean the back of the patient, making sure to promote blood circulation to the heart. We're going to assess the skin for any breakdown or any sores. We're going to dry with a separate towel. And then after we do that, we are going to clean the buttocks. So it's going to go from cleanest to dirtiest. Upwards on the outer sides. Flip the rag, and then on the inner, flip, inner, discard. And with a separate towel, we're going to make sure the patient is dry.
Although not fully shown in the video clip, the client's back was washed with soap and water, rinsed and dried, with a clean part of the cloth with each wipe.
Now that my client is on their lateral side, I can perform back pericare with their consent. I'll start by gaining their consent, and then I'll fold a washcloth in 4, wet it, and apply soap. I'm going to start at the client's buttocks that's not lying on the bed and wash in a circular motion, wiping in one direction and changing the size of the washcloth with every wipe. This fits with best practice guidelines that I'm cleansing the skin properly and not leaving bacteria on the skin. Next, I'll wash the client's buttocks that's lying on the bed with the same technique in a circular motion, changing the sides of the washcloth with every wipe. Next, I'll rinse the skin using the same technique. Next, I will wash the client's anus, wiping away from the urethra up towards the client's back, washing with a clean part of the washcloth with every wipe. And then I'll rinse with using that same technique. Next, I'll pat dry. As I was washing, rinsing, and drying, I was observing the client's skin for any kind of skin breakdown, especially on areas of the coccyx and sacrum. These areas, because the client is lying in bed, is likely to have skin breakdown due to the pressure on these areas. Now with the client turned on their lateral side still, I'll roll up the blue pad underneath them and get the client to roll back onto their supine position. Next, I'm going to doff my gloves, perform hand hygiene, and reposition my client. Next, I'm going to lower the bed down to the lowest position, raise the side rails, remove any kind of privacy measure, and give my client the call bell. I will then gather all my supplies and sanitize my basin. And before I leave, I'll wash my hands and doff my PPE, first my goggles and then my mask. And then I'll perform hand hygiene again and leave the room to document the procedure that the pericare process in terms of how my client handled the process, how they were feeling during the process, and any kind of skin issues I noticed, or to note that the skin was okay. I would document that and inform the nurse in charge.
One important point made in the first scenario was first that infection control was not put at risk through the proper donning and doffing of PPE, which includes proper hand hygiene practice. As Potter and Perry outlines, this is because the chain of infection is broken. Nurses need to follow infection prevention and control practices to break the chain so that infections do not develop. In the scenario, safe washing practices were demonstrated through proper washing techniques, including washing from clean to dirty. And washing using a clean part of the washcloth with every wipe. Cross-contamination did not occur and infection control was not put at risk. Let's look at the second scenario. As a student nurse, you have been assigned to care for that same client who is placed on droplet precautions. But now he wants to be transferred from his bed to a wheelchair. What are your first steps? Let's look at a video of this to help guide us.
Okay, so I'm just going to be helping a client today from their bed to their wheelchair, transferring from their bed to their wheelchair. What I'm going to start by doing is just checking their care plan for any special instructions in terms of PPE that I might have to wear, or any joint problems they might have that might cause them to fall, or any muscle weakness that might cause them to fall, or any kind of paralysis that also might cause them to fall that I have to be aware of when transferring them. So what I'm going to do is just go check that right now. So my client has had a stroke. So they are weak on one side. So I'll take definitely note of that when we're transferring, making sure my equipment's on the right side as well. And yeah, and they're also on droplet precautions. So I'm going to be putting on the correct PPE and gathering my equipment. First, I'm going to start by washing my hands. Hi, Mr. Pereira. My name is Pamela. I'm a student nurse. Can I just ask for your first and last name and your birth date?
Yes, I'm Mariano Pereira. This October 26, 1966.
Perfect. Yeah, and that's what that says there too. Perfect. Okay. I just wanted to, I heard in a report that you like to sit up for lunch. So I was just wondering if you wanted to sit up, transfer to your chair, sit up for lunch, or do you feel like staying in bed and having lunch in bed?
Oh, I want to go to the table.
To the table? Okay, perfect. What I'm just going to do then is I brought in your wheelchair. I'm just going to bring that over, and I'll be right back. I'm just going to provide for privacy and draw my curtain. So I'm just when we transfer, I just need to know what you prefer. Do you prefer to have your shoes on, for me to put your shoes on while you're lying in the bed, or when you're sitting on the side of the bed?
When sitting in the bed.
The side of the bed? Okay, perfect. I'm just going to check that your bed is locked to start. The bed is locked. And I'm positioning the chair on this side so that when we're transferring, you're transferring on your strong side. And I'm putting the bed in the lowest position. It's okay. I'm just going to take this out to start. And I'm just going to explain what I'm going to be doing. So I'm just going to be turning you to your side, and then I'll slowly, we're together, we'll turn to the side of the bed, okay? All right, so just slowly turn to your side. Perfect, good, that's perfect. Do you feel okay? Okay, great. Now I'm just going to be putting the head of the bed up, just as much as you can handle. Usually 45. Just tell me if it's enough when I'm putting it up. Do you feel okay?
Yes.
Okay, perfect. Now, don't worry, I'm going to help you with this. I'm just going to put my hand under your shoulder here, and my other hand behind your thigh, just behind your the back of your knee. And together, I'm going to, using good body mechanics, I'm going to be turning you and positioning you on the side of the bed together. You feel okay? Okay, perfect. All right, I just want you to sit here just for a little bit. Brace the bed with your hands. Perfect. Do you feel okay?
Yes.
Okay, I'm going to be putting on your shoes now. You feel okay still?
Mhm.
Perfect. Now, before we transfer, I just want you to sit here for a few minutes, just so that I can assess for any dizziness, or you tell me. If you feel dizzy or lightheaded, then you can just wait a little bit longer or lie back down. I really don't want any, no one to fall or for you to hurt yourself when we're transferring. That's the main reason for you, just to sit on the side of the bed for a little bit, okay?
So the first thing I have to check with the wheelchair is that the brakes of the wheels are locked and the leg raises are out of the way. So how are you feeling?
I feel good.
Do you feel any dizziness at all?
No, not at all.
Okay, great. So I'm just going to explain what we're going to be doing. So I'm going to assist you to the wheelchair, and by doing that I'm going to ask you to put your hands on the side of the bed.
Like this?
Yeah. So what I'm going to do is I'm going to come and I'm going to hold you by your shoulder blades to support you.
Okay.
On the count of 3, we're going to stand up together, and we're going to slowly pivot and walk to the chair. And then once you're standing in front of the wheelchair, you're going to place one hand on the far side first. And then on the other side, once you're comfortable and ready, we can sit down together. Okay? Does that sound good?
That sounds great.
Awesome. Let's begin. I'm just going to make sure I'm in line with your knees. Come here. Okay, on the count of 3, we're going to stand up. Ready?
Ready.
1, 2, 3, up. Good. Okay, now, just going to wait. Do you feel any dizziness?
No, not at all.
Okay, you ready to proceed?
I'm ready.
Okay. So slowly, one step at a time. You comfortable?
I'm comfortable.
Great. Okay, you're standing in front. Go for this far side. Nice. And the other side. Slowly, let's go down. Good. Now sit upright. How are you feeling?
I feel good.
You feel good? Awesome. Let me just place this blanket on you.
Thank you.
You're welcome. I'm going to put the leg raises and your feet on them. Okay. Awesome. Now I'm just going to place this call bell with you. Okay.
Okay.
If you have any questions or any concerns, you can use the call bell.
Okay.
Just going to wash my hands before I go. And you're ready. Okay, awesome. Someone will be back with you in a bit, okay?
Okay, thank you.
No problem.
At the end of the transfer video skill, the student nurse before leaving the room doffed her PPE. Let's look at a video to see how it is correctly done. Here is a closer look to see how hand hygiene is performed with soap and water, which is important to do if your hands are visibly soiled. Through the wheelchair transfer, key steps were performed correctly so that the client was not at risk for falling. Such steps included locking the bed brakes, locking the brakes on the wheelchair, ensuring the wheelchair is positioned on the client's strong side when transferring. It's important to prevent falls by always knowing your client's ability, and observing for changes in ability constantly. Remember, a client's ability can worsen anytime. Second, another key step shown was the use of good body mechanics. This was shown when the student nurse was bending their hips and knees when preparing to stand with the client. They also ensured they were not lifting the client, but rather just supporting them. Let's look at our last skill scenario. As a student nurse, you have been assigned the same client who is on droplet precautions. They need assistance with cleaning their dentures and performing oral hygiene. What are your first steps? Let's look at another video to guide our practice.
Hi, my name is Shanice. Today I'll be assisting a client with oral hygiene. We're going to start off by checking the client's care plan. We're looking for any special instructions, the client's abilities and limitations, any physical weakness, and cognitive impairment. Next, we'll want to gather our supplies and equipment. You're going to need hand sanitizer, a towel, paper towel, a cup, some water, gloves, a kidney basin, toothbrush, toothpaste, and a garbage receptacle. Optional items would be mouthwash and lip moisturizer. Make sure to practice hand hygiene before entering the client's room. Next, you'll introduce yourself to the client. Hi, my name's Shanice. I'll be your nurse today. I'm here to assist you with oral hygiene. You'll also want to identify the client. You can do this by asking the client's name and date of birth. You can also identify the client by checking the client's ID bracelet. You'll also want to provide some privacy. You can do this by shutting the door or closing the curtain. Some safety precautions we'll want to go over before beginning the procedure would be checking the bed breaks and ensuring that they're on, raising the bed to working level or waist level, and ensuring the client is in the correct position. So you want to have the client in the high Fowler's position. More so like that. We'll also want to bring the bedside table closer to the client. I'm going to practice hand hygiene and don some new gloves and explain to the client the procedure. So today I'll be assisting the client with brushing his teeth. We're going to place a towel around the client's chest, like this, and just tucked under the chin. Next, we'll apply toothpaste to the toothbrush. We're going to do this over the kidney basin, and we're going to add some water as well over the kidney basin. When brushing the client's teeth, you're going to want to start at the gum line and brush in firm strokes upwards. You're going to want to clean the outside, inside, upper, and lower teeth. While you're doing this, you're going to be inspecting the gums, the teeth, and the tongue. You're looking for any sores, white patches, bleeding, swollen gums, or loose teeth. And don't forget to also brush the tongue. We're going to support the client with rinsing his mouth into the kidney basin. We'll then pat dry the client's mouth with a paper towel. We'll also discard of the towel at this point. You can do this by rolling the towel away from the client and placing it in the laundry hamper. Next, I'll remove my gloves and practice hand hygiene. At this point, you can raise the bed rails and lower the bed back to the lowest possible position. You'll also want to ensure that the client's call bell is in reach. Ask the client if there's anything else you can do or get for them. Once the client is comfortable, you can don some new gloves. And you're going to carry the used supplies out of the room. Once you've cleaned the kidney basin, you can return it to the client's bedside table. You can also remove any privacy measures in place. You'll want to clean all the supplies and return them to the correct places. And finally, you'll document the care that was provided, how well the client tolerated the care, and any other observations you may have made. If the client has dentures, you'll check the care plan to see what type of dentures the client has and what cleaning solution is preferred. Next, you'll want to gather your equipment and supplies. You'll need a kidney basin, toothpaste, a denture brush with soft bristles, a denture cup, 2 washcloths, hand sanitizer, gloves, paper towel, and a garbage receptacle. You're going to bring the kidney basin along with the washcloths, the denture cup, toothpaste and the denture brush to the sink. You're going to use one of the washcloths to line the bottom of the sink. This way you don't damage the dentures. Next, you'll practice hand hygiene. And you'll don clean gloves. As you're cleaning the dentures, inspect for any rough, chipped, or sharp areas. You can apply your cleaning agent or toothpaste to the denture brush. You'll then rinse the dentures under warm running water. Ensure not to use hot water as it may warp the dentures. Clean the outer side of the denture using back and forth motion. To clean the inner side of the denture, you're going to position the brush vertically and make upward strokes. You'll then rinse the denture under running warm water. You can place the denture in a clean area of the kidney basin. You'll repeat these steps on the other denture. Once both dentures have been cleaned, you can place the denture brush and the cleaning agent in the kidney basin. Rinse the denture cup. Dry the denture cup. Place the clean dentures in the denture cup. And place the denture cup in the kidney basin. Remove gloves. And use a paper towel to turn off the faucet. Practice hand hygiene before donning new gloves. And then you can let the water drain out of the sink. You'll wring the cloth out and place in the laundry hamper. You can then remove your gloves. Practice hand hygiene again. And then you'll return the cleaning agent, the brush, and the kidney basin to the client's bedside table or bathroom.
Poor oral hygiene can lead to illness. If bacteria grown in the oral cavity aspirates to the lungs, a respiratory infection could develop. Gum disease could contribute to higher risk of heart disease. Illness can lead to poor oral health. Some medications and diseases cause oral health problems such as dry mouth or swelling of the mouth and tongue. Assisting a client with oral hygiene prevents infections and cavities which could cause pain and discomfort. Prevents gum disease, could in worst cases lead to tooth loss. Prevents odors. Odor and appearance of the mouth and teeth may impact a client's confidence. Improves the taste of food which may improve appetite and nutrition.